Welcome to Eye Contact. I'm Aidan Hanratty. Today we're talking to Dr. Michael Amon about facing the unexpected in cataract and refractive surgery. Welcome, Dr. Amon.
Welcome you.
Sooner or later, doctors can expect to face unexpected developments during cataract and refractive surgery. How can you prepare for the fact that anything can happen at any moment?
It's very important that you have a proper pre-op assessment. First, you have to create a good patient's history. You have to ask him about his therapy. Tamsulosin, for instance, is a question, if he has a diabetes, if he's using some miotic drugs, so that you know if there is something to expect which is not in any patient to be seen. Yeah? The next thing is that you have a proper slit lamp examination. You can see and read a lot from the eye and look into the prospective surgery. So you look on the lens itself, if it is a very hard lens, for instance, if it's wobbling, if you have some phacodonesis, if there's a deep anterior chamber or a very narrow anterior chamber, a shallow one. You look on the cornea, there might be some opacities, there might be a cornea gudata, and so you have to plan your surgery very precisely in order to avoid all these kind of complications.
Of course. You can also expect to encounter new IOLs, new lasers. How do you keep on top of these technologies while also being aware of the complications that can occur?
It's very important that you are used to the instruments, that you are used to the lens you use. You should have a standard lens, but you should also have an armamentarium in case of complications. It's important, I think, that you read peer review publications,
Yes.
that you go to the congresses. Maybe you need some wet lab for a new technology, for a new lens, but when you are using these kind of lenses, you should stay on your technique. I think it's not good in a complicated situation that you just test something new.
Of course.
You get some stress during that complication. You should calm down, keep your mind in the way, and do the surgery as proper as possible. So I think it's important that you use the lenses in a certain amount of situations. Yeah, you are not able to use a new lens in a bad situation.
Of course, yes. How important is it to tell your patients to expect the unexpected?
It's very important. I think it is important to give the patient an informed consent, mentioning everything which could happen, and telling it vocally and by writing. Both is important, I think, because it is intraocular surgery, and there may happen very bad things to the eye, especially in refractive surgery, where the expectation is very high. You have to tell the patient that in any case, there might be some severe complication. Maybe a reoperation is necessary or something else. Yeah? So that's very important.
Do you have any advice for young ophthalmologists who might be starting out in their career?
Absolutely. There are so many options nowadays. You have simulation systems. You should use wet labs as often as possible. You can try to do suturing, not only on eyes, but even on some paper or something like that, so that you get your hands very precise working. And then it's very important to assist good surgeons. If you have the option or the opportunity, you should use that. Look on their hands, look on the position, look on all these other things, not only through the microscope, but beside, if you look on the hands of the surgeon, you can see how to make the surgery more efficient. Yeah? And keep calm, keep down with your nerves and your pulse, because the cooler you and relaxed you are, the better and safer the surgery will be.
Of course. Thank you so much.
Pleasure.
For more information on this and related topics, please visit us at eurotimes.org.